You know, there's something that keeps me up at night as a medical professional, and I think it's something you need to hear today. Every single day, thousands of people walk into emergency rooms across the country with stroke symptoms. And you know what the doctors tell me? In almost every case, their body was screaming warnings at them for days before, sometimes even 72 hours before that stroke happened. But here's the heartbreaking part. Most people had no idea what those warnings meant. They ignored them, brushed them off as nothing serious, or just thought they were tired or stressed. And that delay, that lack of knowledge, can mean the difference between a full recovery and permanent disability or worse. I'm Dr. Vital Alert, and today I'm going to share with you the 5 warning signs that emergency room doctors check for first when someone comes in worried about a stroke. These aren't the obvious signs you might already know about. These are the subtle clues, the ones that appear days before a stroke happens, the ones that give you precious time to get help and potentially save your brain from permanent damage. And trust me, by the end of this video, you'll know exactly what to look for, not just in yourself, but in your loved ones too. Now, before we dive in, I want you to understand something crucial. Your brain is incredibly precious. It controls everything about you. Your memories, your personality, your ability to move, speak, and think. When a stroke happens, blood flow to part of your brain gets cut off, and brain cells start dying within minutes. But here's the good news. Strokes don't usually happen out of nowhere. Your body sends you warnings, like a car's check engine light, telling you something's wrong before the engine completely fails. The problem is most people don't know how to read those warning lights. So let's talk about the first warning sign that ER doctors look for, and this one surprises most people because it seems so minor. It's sudden confusion or trouble understanding simple things. Now, I'm not talking about forgetting where you put your keys or blanking on someone's name. That happens to all of us. What I'm talking about is when someone suddenly can't follow a simple conversation, or they can't understand basic instructions that would normally be easy for them. Picture this. You're talking to your spouse about what to have for dinner, a conversation you've had 1,000 times, and suddenly they're looking at you with this confused expression, like you're speaking a foreign language. Or maybe you ask them to hand you the remote control, something incredibly simple, and they just stare at it like they don't know what to do with it. This isn't dementia developing overnight. This is your brain not getting enough blood flow to the areas that process language and understanding. Here's what's happening inside the body. Small blood clots might be temporarily blocking tiny blood vessels in your brain, or you might be having what doctors call a transient ischemic attack, or TIA. Think of it like a mini-stroke, a warning shot. These episodes might only last a few minutes or a few hours, and then the person seems fine again. That's why so many people ignore it. They think, oh, I was just tired, or I'm just getting older. But ER doctors know that when someone comes in with these symptoms, even if they've passed, it means a major stroke could be coming within the next few days. I remember a patient who came to the ER 3 days after his wife noticed he couldn't figure out how to work the coffee maker, something he'd done every morning for 30 years. He brushed it off, said he was just distracted. 2 days later, he had a massive stroke. Thankfully, because his wife insisted they come in after that coffee maker incident, we had already started him on blood thinners and were monitoring him, so when the stroke happened, we caught it immediately and he made a full recovery. That confusion saved his life because someone recognized it for what it was. Now let's move to the second warning sign, and this one is even more subtle, which is why it gets missed so often. It's sudden weakness or numbness, but here's the key. It's usually just on one side of the body. You might notice that one arm feels heavy or weak, or maybe one leg isn't responding quite right. Sometimes it's facial drooping on just one side. And just like that confusion we talked about, this might come and go. It might last 15 minutes and then your arm feels fine again. The reason this happens on one side is because each side of your brain controls the opposite side of your body. So if there's a problem with blood flow on the left side of your brain, you'll notice symptoms on the right side of your body and vice versa. When ER doctors see someone with one-sided weakness, even if it's resolved by the time they get to the hospital, alarm bells start ringing. They know this is a red flag that can't be ignored. Here's what you need to do if this happens to you or someone you know. There's a simple test called the FAST test that doctors use. FAST stands for face, arms, speech, and time. For the face, ask the person to smile. Does one side of their face droop? For arms, ask them to raise both arms. Does one arm drift downward? For speech, ask them to repeat a simple sentence. Is their speech slurred or strange? And time means, if you see any of these signs, it's time to call emergency services immediately. Don't wait to see if it gets better. Don't wait until tomorrow. Call for help right away. I can't stress this enough. Time is brain. Every minute that passes during a stroke, nearly 2 million brain cells die. But if you get to the hospital within the first few hours, there are treatments that can dissolve the clot and restore blood flow, potentially preventing any permanent damage at all. Those treatments only work in a narrow window of time, though, which is why recognizing these early warning signs is so critical. Now that we've covered confusion and one-sided weakness, let's talk about the third warning sign that ER doctors look for first, and this one involves your vision. Sudden vision problems are one of those warning signs that people almost always dismiss. They think maybe they're just tired, or maybe they need new glasses, or perhaps they stared at their phone screen too long. But when ER doctors hear about sudden vision changes, especially in someone over 50, they immediately start thinking about stroke. And here's why you should too. The vision problems I'm talking about aren't gradual. They happen suddenly, sometimes in just one eye, sometimes in both. You might experience blurred vision that comes out of nowhere, or you might lose vision completely in one eye for a few minutes. Some people describe it like a curtain coming down over their eye. Others say everything suddenly goes dark or gets extremely dim. Sometimes people see double, where one object looks like two. And just like those other warning signs we talked about, this might only last a few minutes before your vision returns to normal. What's happening in your body during these episodes is that the blood vessels supplying your eyes, or the visual processing centers in your brain, aren't getting enough blood flow. Your retina, the back of your eye, needs constant blood supply to work properly. When that supply gets interrupted, even briefly, your vision goes haywire. And if the blood vessels in your eye are having problems, chances are the blood vessels in your brain are having similar issues. They're all connected, part of the same system. I had a patient, a wonderful woman in her 60s, who told me she kept having these episodes where everything would go blurry in her left eye for about 10 minutes, then clear up again. This happened 3 or 4 times over a weekend. She figured she was just exhausted from gardening. She didn't want to bother anyone, didn't want to seem like she was overreacting. Monday morning she woke up unable to move her right side. She'd had a major stroke overnight. When we talked to her later, after she'd started recovering, she said if she had known that vision problem was a warning sign, she would have come to the ER immediately. That knowledge could have changed everything for her. So if you or someone you know suddenly experiences vision changes, especially if it's in one eye, or if you're seeing double when you weren't before, don't wait. Don't assume it's nothing. Get checked out right away. It takes just a few minutes for doctors to run the tests that can tell if you're at risk for a stroke, but those few minutes of your time could save your brain. Now let's move on to the fourth warning sign, and this one is particularly tricky, because it's something everyone experiences from time to time, which is why it gets overlooked so often. I'm talking about sudden, severe headaches that feel different from your normal headaches. Not just any headache, but what doctors call a thunderclap headache. The worst headache of your life, one that comes on suddenly and intensely. Most of us get headaches. Maybe you get tension headaches from stress, or sinus headaches when the weather changes, or maybe you're prone to migraines. You know what your normal headaches feel like. But what I'm talking about here is completely different. This is a headache that hits you like a lightning bolt, reaching maximum intensity within seconds or minutes. People describe it as the worst pain they've ever felt in their head. It's often accompanied by nausea, vomiting, sensitivity to light, or a stiff neck. This type of headache can signal that a blood vessel in your brain is leaking or about to burst, which is a type of stroke called a hemorrhagic stroke. It can also be a warning sign that a clot is forming or that blood flow is being restricted in a dangerous way. When ER doctors hear someone describe a sudden, severe headache that's different from anything they've experienced before, they immediately order brain imaging because this could be a life-threatening emergency. Here's what you need to understand. Not every severe headache is a stroke warning, but any headache that comes on suddenly, reaches extreme intensity quickly, and feels unlike any headache you've had before needs immediate medical attention. Don't take painkillers and hope it goes away. Don't lie down and wait it out. This is a call for emergency help situation. I've seen too many people who waited, thinking the headache would pass, and by the time they got help, significant damage had already occurred. There's also something else that often comes with these headaches that people do not realize is connected: sudden dizziness or loss of balance. This brings us perfectly to our fifth and final warning sign that ER doctors check for first: sudden trouble walking, dizziness, or loss of coordination and balance. This isn't just feeling a little lightheaded when you stand up too fast. This is sudden, unexplained difficulty with balance and coordination that makes walking feel like you're on a boat in rough seas. Your brain's cerebellum, located at the back of your head, controls your balance and coordination. When blood flow to this area gets compromised, you might suddenly feel dizzy, have trouble walking straight, or feel like the room is spinning around you. Some people describe it as feeling drunk, even though they haven't had anything to drink. You might reach for something and completely miss it, or find yourself stumbling when you try to walk, even though there's nothing in your way. What makes this particularly dangerous is that people often attribute these symptoms to inner ear problems, low blood sugar, dehydration, or just getting older. They sit down, drink some water, and wait for it to pass. And sometimes it does pass, just like those other warning signs we've talked about. But that doesn't mean everything's fine. It means you've just had a warning that your brain isn't getting the blood flow it needs, and a major stroke could be on the horizon. I remember a gentleman who came to the ER after falling twice in one day. He said he just felt off balance, couldn't quite walk straight. His family thought maybe he had an ear infection. But when we examined him and ran tests, we discovered he had severe blockages in the arteries leading to his brain. We were able to intervene before a major stroke occurred, but if he had waited even another day or two, the outcome could have been completely different. Here's something crucial I want you to understand about all 5 of these warning signs. They often don't happen in isolation. You might experience 2 or 3 of them together, or you might have one symptom one day and a different symptom the next day. The key is recognizing that these aren't normal everyday occurrences. These are your body's alarm system telling you that something is seriously wrong and needs immediate attention. You know what breaks my heart? When I talk to stroke survivors and their families, and they tell me about the warning signs they experienced but didn't recognize, the confusion that lasted 20 minutes, the blurry vision that came and went, the severe headache they took aspirin for and tried to sleep off, the dizziness they blamed on not eating enough breakfast. Almost every single time they say the same thing: if only I had known, if only someone had told me what to look for. Well, that's exactly why I'm here talking to you today, because knowledge truly is power when it comes to preventing strokes and minimizing their damage. Let me tell you something that might surprise you. Stroke is the 5th leading cause of death and a leading cause of disability in adults, but here's the amazing part. Up to 80% of strokes are preventable. 80%. That means if we can recognize the warning signs early, if we can get people to the hospital in time, if we can start treatment before major damage occurs, we can prevent the vast majority of strokes from causing permanent harm. But it all starts with awareness, with knowing what your body is trying to tell you. Think about the 5 warning signs we've covered today: sudden confusion or trouble understanding simple things, sudden weakness or numbness, especially on one side of your body, sudden vision problems, whether it's blurred vision, loss of vision in one eye, or seeing double, sudden severe headache that's unlike any headache you've had before, and sudden trouble walking, dizziness or loss of balance and coordination. These aren't random symptoms. These are specific, measurable warning signs that something is going wrong with blood flow to your brain. Now, I want to talk about something really important: what you should do if you experience any of these symptoms, even if they go away quickly. First and most important, call emergency services immediately. Don't drive yourself to the hospital. Don't wait to see if it happens again. Don't call your regular doctor's office and try to schedule an appointment for next week. Call for emergency help right away. When you're having stroke symptoms, every single minute matters. There are treatments available that can dissolve blood clots and restore blood flow to your brain, but these treatments only work if you get them within a few hours of symptom onset. After that window closes, the damage becomes permanent. While you're waiting for emergency services to arrive, here's what you should do. If it's someone else experiencing symptoms, help them lie down with their head slightly elevated. Note what time the symptoms started, because doctors will need to know this information. Don't give them anything to eat or drink, because they might need emergency treatment that requires an empty stomach. Stay calm and reassuring. If they're having trouble speaking, don't pressure them to talk. Just stay with them and keep them comfortable. Here's something else that's really important to understand. Even if the symptoms go away completely before the ambulance arrives, you still need to go to the hospital and get checked out. Those temporary symptoms, what doctors call transient ischemic attacks or TIAs, are serious warning signs. Studies show that someone who has a TIA has a 10 times higher risk of having a major stroke compared to someone who hasn't had a TIA. And a significant number of people who have TIAs will have a major stroke within the next 90 days if they do not get treatment. So even if you feel fine again, even if the symptoms only lasted 5 minutes, you absolutely need to get evaluated by a doctor. When you get to the emergency room, the doctors will run several tests. They'll do a physical examination, checking your neurological function. They'll likely do a CT scan or MRI of your brain to look for signs of stroke or bleeding. They might do an ultrasound of the blood vessels in your neck to check for blockages. They'll run blood tests and check your heart rhythm. All of these tests help doctors figure out what's causing your symptoms and what treatment you need to prevent a major stroke. Now I also want to talk about prevention, because while recognizing warning signs is crucial, preventing strokes in the first place is even better. There are several risk factors for stroke that you can actually control. High blood pressure is the #1 risk factor for stroke. So if you have high blood pressure, work with your doctor to get it under control. Diabetes, high cholesterol, smoking, obesity, and lack of physical activity all increase your stroke risk. The good news is that all of these are modifiable. You can make changes that significantly reduce your risk. Even simple lifestyle changes can make a huge difference. Eating a diet rich in fruits, vegetables, and whole grains while limiting salt, saturated fat, and processed foods can help. Getting regular exercise, even just 30 minutes of walking most days of the week, can reduce your stroke risk. If you smoke, quitting is one of the most powerful things you can do for your brain health. And if you have conditions like atrial fibrillation, high blood pressure, or diabetes, working with your doctor to manage these conditions effectively is absolutely critical. I want you to do something for me right now. Think about the people in your life who you care about. Your spouse, your parents, your siblings, your close friends. Share this information with them. Tell them about these 5 warning signs. You might just save their life, seriously. Stroke doesn't just affect the person who has it. It affects entire families. It changes lives forever. But it doesn't have to be that way if we catch the warning signs early. And here's what I want you to remember above everything else. Trust your instincts. If something feels off, if your body is doing something unusual or concerning, don't ignore it. Don't brush it off. Don't wait to see if it gets better. Seek medical attention. It's always better to go to the emergency room and have doctors tell you everything's fine than to wait and suffer a major stroke that could have been prevented. There's no such thing as overreacting when it comes to potential stroke symptoms. I really hope this information helps you and your loved ones stay safe and healthy. Knowledge is power, and now you have the knowledge to recognize these critical warning signs. You know what ER doctors look for first. You know what your body might be trying to tell you. And you know what to do if you or someone you love experiences these symptoms. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Subscribe to Dr. Vital Alert for more life-saving medical information that could make a real difference in your life. And I'd love to hear from you in the comments. Have you or someone you know experienced any of these warning signs? What was your experience? Your story might help someone else recognize their own symptoms and seek help in time. Remember, your health is precious and your brain is irreplaceable. Take these warning signs seriously, act fast when you notice them, and never hesitate to seek emergency medical care when something doesn't feel right. Stay vigilant, stay informed, and take care of yourself. Until next time, this is Dr. Vital Alert, helping you decode your body's vital signs before it's too late.